Welcome to UofL Today with Mark Hebert on Talk Radio, WKJK, and iHeartMedia. This is the show about all of the things going on at the University of Louisville, where we talk to all the great researchers and students and others about what the programs are doing, what research they're doing. So, on the show today, some UofL researchers may have found the magic formula to recycle all those old tires back into rubber, and we will talk with them. And the University of Louisville has received a big grant to train healthcare, social workers, and others to provide better care to seniors in rural Kentucky. We'll talk to the heads of the Kroeger Center about that work and a big grant that they just received. But first, you've heard about parents refusing to get their kids vaccinated against measles. But what do parents think about getting their children the flu vaccine? Dr. Becca Hart is in UofL Pediatric Emergency Medicine, and she is here to talk about the flu vaccine and little kids. Becca, good to see you.
Hi, thanks for having me on.
I'm glad you are. Well, let's talk about the problem, or is there a problem with parents not getting flu shots for their kids?
So it's definitely a problem, and it has been. It's a problem for parents not getting shots for their kids, as a problem for people not getting shots for themselves when it comes to the flu vaccine. I mean, you hear a lot in the media right now about anti-vaxxers or people who are refusing sort of the standard gamut of vaccination, right? MMR, but all of the childhood vaccines. But we've known for a long time that there's a lot of hesitancy about the flu vaccine in particular, even kind of before this was an issue. You hear a lot of people every year who say like, oh, I don't want to get the flu vaccine because I'm going to get the flu if I get it, or I don't think it works. And so those are really common misconceptions that we deal with in pediatrics in particular, because flu is a big problem for us. I mean, pediatric flu not only affects lots of children, 11.5 million in the 2017 to 2018 season, but it causes a lot of problems. So a lot of people think the flu is, it's like if I get the flu, it's just the flu. But there were 183 reported deaths from pediatric flu in the 17-18 season, and that's probably a significant underestimate. So this can cause a lot of long-term consequences, and it's something that we fight on a regular basis.
So kids are dying from the flu.
They do. And that was a particularly bad season, but every year we have at least a few in our own hospital, which is, it's devastating because this is not a completely preventable disease, but an imminently preventable disease.
And you did some research where you talked to parents in, I assume, the emergency room at Norton Children's Hospital,
yeah.
Correct? So what was the research about, and what were you trying to figure out? What'd you find?
So we basically started off looking into what do parents feel about the vaccine, and how do they feel about getting it in the pediatric emergency department. As of the time that we started the research, there wasn't a lot of precedent for offering the vaccine in the ED setting, because most people assume you're going to get the vaccine at your regular doctor or maybe at like a clinic or something like that. But this wasn't a regularly accepted setting for that vaccine. And so what we did is we surveyed parents who were visiting during the summer months before the flu season started about their attitudes about vaccination. Did they plan to get their kids vaccinated? If they did, would they be interested in getting it in the ER if we offered it? It was purely hypothetical at that point.
Right.
And then what we did is after the flu season that year ended, we called all of those parents back that we had interviewed initially and said, okay, so you said you were going to get the shot, or maybe you didn't. Did you end up getting your kid vaccinated? And if not, would you have potentially accepted one if we had had it in the ER? We also asked about things like barriers to vaccination, people's, general attitudes, like did they think it works? Do they think it's, effective? And that kind of thing. And what we found is that in our initial survey, something like 85% of the parents said, yeah, I'm totally going to vaccinate my kids, of course, because that's what you're supposed to say. When we called them back, about 50 to 55% had actually gotten their kids vaccinated, which is essentially standard across the country. About half of the population gets a shot every year. And among those who didn't get vaccinated, which was kind of our main interest group, we found that about half of them said, yeah, if you had offered it then, I probably would have gotten it. The only reason I didn't was because I didn't have time, or I wasn't at the doctor, or there were other, transportation barriers or things like that had prevented them from being vaccinated. And so as a result of that project, we started regularly offering our flu vaccines in the ED, and that's kind of been our focus from that point.
So is that now going to be the norm, you think, in not just in Norton Children's, but in other children's hospitals across the country? When a kid comes into the emergency room, you tell the parents, hey, we can give your kid a flu shot while he's here. Is that okay?
Yeah, I think it's becoming more of a norm. There's certainly a lot of interest in this topic across the country. So when we started it, when we initially presented this research at Pediatric Academic Society's meeting, We didn't bump into a lot of people who said, oh, yeah, we give this on a regular basis. But now there has been a lot more talk about this process throughout the country. And so a recent project that was presented at the same meeting last year by a group at Children's Hospital Wisconsin, they're working on not just we've established a program, but like we're all working on improving our vaccination rates within the emergency department. So I do think it's becoming a much more regular thing.
We're talking with Dr. Becca Hart. She is in UofL Pediatric Emergency Medicine at the University of Louisville, works at Norton Children's Hospital in the emergency room, I assume, right? As kids come in.
Yep.
What are some of the things that parents tell you? You mentioned a few of them as the reasons that they don't get them. You know, they say, well, I didn't have time. But I guess what I'm really getting at, the gut question is, how many parents are out there saying, and what percentage of parents are out there saying, you know what, I have religious beliefs, I think it's going to cause the flu if I get them a flu shot. That's why I'm not getting. They're anti-vaxxers.
Right. So I don't get a lot of the religious beliefs, but we do hear from a lot of people. And when we did our original survey, certainly the number one barrier that people listed as why I didn't get the flu vaccine is because they either think it causes the flu or they don't think it works. And unfortunately, we know that it doesn't cause the flu. The flu vaccine, especially the shot, is an inactivated virus. You cannot get the flu from the shot. And so this is just a really common misconception among the population.
But that's been around for a long time.
It has. It's
I heard
nothing
that when I was
new.
a kid. So.
And so it's one of the other areas that we're trying to sort of bolster research at this point is how do we overcome this? And so there are other projects that are going on within our department and like with our infectious disease team and our hospital team about how do we overcome vaccine hesitancy in patients. And there are some promising techniques that are starting to come out of that, but it's an ongoing issue. The reason that I think it was so important for us to look at these issues in the pediatric emergency department is because while you do probably have, I would say more than half of the people that we interviewed, their main reason for not getting it was I either don't think it works or I think it's going to make me sick. But for the other half, a lot of them listed things like transportation or I just didn't go to the doctor. You know, 'cause
Right.
Kids, once they're over 2, don't go to the doctor but once a year. And if they go in the summer, they're probably not getting the flu shot. And so trying to capture them in a setting where they're being seen for whatever reason is one of the ways we can help.
How young can kids be to get the flu shot?
They can actually get it down to the age of 6 months. Kids who are under age 9 and are getting it for the first time do require a booster 1 month after the original vaccine. But once they've had it for the first time, after that, it's just once a year.
And what's the message to other doctors, other pediatricians who work in this field as to how you go about getting parents to give their kids the shot, flu shot?
I think it's a really tough topic, but I think that the number one thing we can do is just talk to parents because a lot of people who I ask and they say like, oh no, I don't want the shot. My first response is, okay, can you tell me why? And just being open and, you know, understanding that whatever reasons they have, even if I think they're wrong or don't agree with their stance, I'm not going to get anywhere by just saying, no, you're wrong.
Or berating them and saying
right.
how stupid
and
you
so
are.
Trying to meet them where they are and show and respond to their concerns as opposed to just like you said, berating them or saying like, or just ignoring that concern. You know, that's not going to help us anywhere. And so sometimes, I mean, you really can overcome that just by saying, oh, like you think you're worried that it's going to cause the flu. So we actually know that that's impossible. And here's why. And you don't reach everybody with that argument, but you get at least a few. And I think a lot of people, you know, we work in medicine in an environment where we are constantly busy. You have a very tight expectations for how many patients you're going to see and how long you have to spend with those patients. And it's not always easy to spend that time taking that conversation to the next step. And so a lot of people I think are like, oh, do you want the flu vaccine? No. Okay, bye.
And
if we can even take a couple of minutes to talk, sometimes we can overcome that.
All right. Dr. Becca Hart, appreciate it. And tell all your patients, and I'll try and tell them to get their flu shots and get their kids vaccinated.
We'll be working on it starting in September.
Okay, very good. Some companies have figured out how to break down rubber tires and use them for things like playgrounds and things on the ground, but nobody has quite figured out how to break them down and then make them into rubber again. Well, UofL chemistry professor Jerry Willing and Patrick Kroeger, a UofL PhD student, have licensed their invention to a company that thinks they can pull this off. Good to see you guys.
Thanks for having us.
That was kind of an ominous intro, wasn't it?
Yeah.
Hey, we got big things planned for you guys is what we're saying, I think. All right, well, let's talk first about just in general. You two are in what kind of engineering? What kind of engineering you do? Jerry, what do you do?
So chemical engineering, I'm associate professor there and the associate chair of the department. So.
Okay, Patrick?
And I am a PhD student in the Department of Chemical Engineering.
Okay. So you started looking at rubber. So how did this all start? Jerry, how did you start looking at the rubber and whether you could break it down and recycle it?
So it began really early on, about a decade or so ago. There was a group of us in the engineering school, civil engineering department, chemical engineering department, and the Rapid Prototyping Center. We were on a grant for the American Water Works Association. And one of the new water disinfection technologies was causing rubber components in the water utility infrastructure to decompose at a really accelerated rate. And so
These are like rubber hoses, kind of, or the rubber inside? What was the rubber that was decomposing?
So there's rubber everywhere in the water utility infrastructure, but the key one is every 20 feet of pipeline, there's a rubber gasket.
Okay.
So if that starts to degrade, that's where you start getting weak spots. And as we've seen in Louisville over the last 5-10 years, pipelines break, streets get torn up. So, obviously this is a major concern for them. And so they wanted to know what was going on and could we get some lifetime prediction? Were there certain rubbers that were a little more susceptible to this than others? And so we ended up working on about a 5 or 6 year long project trying to identify what the mechanisms were, what rubbers were most affected by it. And it was kind of during that project that I started thinking about, this is sort of happening on its own. Can we design a system where we really take advantage of that? So a couple of years after the project ended, I was finally able to recruit a student who was willing to see if he could give it a go and try to prove out the concept. And as we were working out that, we actually came up with the idea of, hey, we've got some of this stuff coming off of our process. Based on the chemistry, we really should be able to kind of recycle it back into new rubber. And lo and behold, we were. And
so you took something that was bad happening to things in water or water systems, the degradation of the rubber in them, and said, maybe we can turn this around and make something good out of it.
Yep.
Is the bottom line,
Exactly.
right? Is that pretty much it, Patrick?
Yeah.
All right, so what role did you play in this, Mr. PhD student?
Yeah. So it started in 2012. I wasn't yet a PhD student. I was a master's of engineering student in the same department. And I just was interested in research, deciding between which route to go, whether a master's thesis or non-thesis option. So I went into Dr. Willing's office and we just had a discussion about what options and research avenues he had available. And that idea sounded like the most, it had the most potential to be
The recycling rubber,
to
breaking down
changing
rubber and recycling
the
it?
world, yeah. So
Yeah, it does.
we just got started late summer of 2012, and we're able to have a provisional patent processed in the end of 2014. Received our patent in 2016, and I've been slowly, steadily working on it ever since.
And now you're working for a company that the patent you've sold the rights to, right?
Exactly, yes.
yeah, so the University of Louisville, through their tech transfer office, was able to, they were actually approached by this company and was able to work out a licensing agreement, and they've been full steam ever ahead since June.
All right, we're talking with Jerry Willing, who's a professor at the UofL Speed School of Engineering, and also Patrick Kroeger, who's a PhD student at the Speed School. All right, so how does this work? We've got an old tire. You get done, they take the old tires off my car, and nowadays I don't even know what they do with them now. Sometimes they break them down, as I said, to put the rubberized thing on the bottom of playgrounds and those kinds of things. So that's what they can do now. They can break it down to little tiny pebbles, right?
Yeah.
But they can't get it fully liquid. What's the word?
I mean, that's
liquefied,
a good
guess?
way to describe it.
Yeah.
Yeah, liquefied. So, I mean, here is something that you might see after a tire's been chipped up.
All right, so we're looking at, for
We're
radio
looking at-
purposes, it's a little tiny square, about an inch around, and it's rubber.
And it's rubber, yeah.
Okay.
So the next step in our process is we need to get it very small. So this is that same rubber, but
Looks
it's
like
been,
sand. Looks
yeah,
like
it looks
black
like sand.
Yeah, it basically gets pulverized. You can do that by a number of different means, but yeah, the key point here is that it comes really, really small.
And you can do that now. There are companies already doing that now.
Oh yeah, there's a company that actually does that through a cryogenic process.
Okay.
Yeah, so we
Okay.
purchased this.
Okay.
At
All right.
this
So you can
stage.
get that far.
Yeah, and then we use our chemical process to turn it into this almost silly putty-like material.
Oh yeah.
So I'll take the top off for
Okay.
the TV and
Okay.
see how I'm able to manipulate it
Yeah.
It's almost like
So
a paste.
Yeah, it looks like a hard paste. So, and that's the key. That's what's new about this, is that you can take those grains right there that looks like sand, and through a chemical process turn it back into something rubberized that could be useful.
Right.
Is that
So
fair?
yeah.
Is that a
So
fair
what?
assessment?
So what companies would end up doing is they would basically take this material and then work it back in with some virgin rubber back into their process to then kind of give you we've got 10% recycled rubber in our product, or
Make a new tire.
Okay.
Yeah.
So, but you couldn't make a brand new tire just out of this recycled
Can't make
material.
a new tire just out of
but
this.
you could include that, like recycled paper, for instance, is partially recycled paper,
Right.
or partially new paper.
Yeah. So anytime you go through a process like this, there is a little bit of loss of properties. Anytime you're dealing with rubbers, plastics, anything like that, you're dealing with these really long chain molecules, and these processes, while they don't completely destroy the molecules, they will start chipping away at the size. And it's really the size that then relates back to performance. Mm-hmm. So no company would want to try to remake a 100% recycled tire just because they're not going to be 100% sure that the properties are always going to hold. So they're always going to want to try to do a blend.
Patrick, why is this exciting?
It has incredible opportunity in the market. So our Duro sustainable rubber was created out of basically thin air in March of this year. And the CEO, Ian Lowe, approached me and said, do you want to come on and continue to develop this project? And so we worked out an agreement. We opened an R&D facility, and we are planning to begin construction on our first commercial plant next year. It'll produce 20 tons per day of a recycled, reclaimed rubber product. And then our further goals are to put plants around the world producing 200 tons per day each plant, up to 20 or more. So,
and obviously that's exciting for you, and did you two develop this product, and for the University of Louisville. Why is it exciting, you think, for Joe Schmo citizen that out there that just riding down the road on his tires? Why should he or she be excited about this technology?
So it creates the opportunity to reduce landfill waste. Tires can be a pretty big issue when they're sitting in landfills. They're susceptible to lightning strikes and large fires. Just Google tire fire, and you'll see some pretty impressive videos. So that it reduces that risk. It also reduces waterborne illnesses caused by mosquitoes. That tires filled with water, mosquitoes breed in that water, and they escape to local areas.
Yeah. You can take old tires and turn them into new ones is the bottom line on this.
Yeah.
Right.
Yes, yeah. And Jerry, what does this mean for you two? You two developed this technology here at the University of Louisville. So A, what does it mean to you two to have the patent on this, I assume? And then secondly, what's it mean for the University of Louisville down the road if this turns into a success, as Patrick just talked about?
So personally, I mean, as an engineer, you always want to be part of developing that next new big process. And it's always, that thought that, I want to be into a position where I can actually affect change in the world. And this is a really big change. The number of tires, the amount of waste rubber that we're putting out there is just astronomical. And you talked a little bit about, we can chip it up and we can throw it on playgrounds or things like that. But the amount of material that's getting used for that is just such a minor fraction of the amount of material that we're generating. It's not even funny. Mm-hmm. So being able to impact that area is so huge. And I kind of view that as my role as an engineer is I'm supposed to be solving societal problems. Well, this is a pretty big societal problem to solve.
Yeah.
And in terms of UofL, being tied to a technology like this where, we are an urban institution and, having a lot of that excess material that you have to deal with, especially in urban settings, and being able to do something with it, I think really speaks to our mission as a metropolitan research institution.
And Patrick, the commercialization of this is big, though. I mean, you not only tend to have a tendency to make some money off of this if it goes and it works, but the University of Louisville also gets because we sold the rights. Isn't that how that works?
Exactly.
Yeah.
That is how that works, yes.
Which is very cool. So for those of you who are wondering if U of L is an innovative place and is doing some great things in entrepreneurship, I would say you look at these two guys, and that's what you're looking at. Great innovation. So, congratulations on this. I hope you pull it off. And Patrick, I hope working for this company. What's the name of the company again? That's going to be making this?
Arduro Sustainable Rubber.
Arduro Sustainable Rubber. I hope that turns out to be a great career for you.
All right.
Sounds like
I'm
on the
excited.
path. All right. And look for those, Goodyear and Goodrich tires with some recycled material that was started at the University of Louisville.
Yep.
Okay. All right. Jerry Willing, appreciate you being on the show as always. Patrick, good to meet you.
Thank you.
Senior citizens in rural Kentucky face special challenges in securing health care and finding mental health providers. The Kroeger Institute and Kent School of Social Work at UofL are hoping to help our seniors with a big grant from the federal government. Anna Faul is the director of the Kroeger Institute and a professor in the Kent School. And Joe D'Ambrosio is also with the Kroeger Institute as well as the School of Medicine. They're going to talk about that. So welcome to both of you.
Thank you.
Thank
Nice
you.
to be here.
All right, let's start right off the top. What's the Kroeger Institute? For folks who have no idea what the Kroeger Institute is, what is it?
The Kroeger Institute is an institute who focuses on optimal aging. We were the Institute for Sustainable Health and Optimal Aging, and through a generous donation from the Kroeger family, we became the Kroeger Institute. So our focus is to promote wellness, to promote aging care, to promote everything about aging and how you age well. And really, to be honest with you all, it starts at birth.
Okay.
So that's where we start
Well, it's not
aging.
very aging at birth. I mean,
But you start aging the
That's
minute
true,
you are
you do
born.
start your
So
first
how
day.
can we do that from the first day onwards, doing it in the right way? So we bring professionals, academics, workforce, everyone together to work together for one aim, and that is to have a healthy life until we die.
okay, well, let's talk first about this grant. It was a big grant that y'all got to go out into rural areas of the state and to help provide some support and health care for older citizens out in rural areas of Kentucky. Why don't you tell us about that grant?
So I'll just start, and then Joe, you can jump in. So the whole focus of this grant has been, and it's with the Department of Health and Human Services, and they're trying to create age-friendly healthcare systems. Now, if you look at our healthcare system right now, it's very fragmented, and it's very difficult sometimes to manage care. So what we're trying to do is trying to develop a workforce who can understand what it means to provide age-friendly healthcare services. And that really means that we focus on what the person wants who sit in front of you who needs the care. What exactly are their goals in life, and how can you help them create wellness goals for them? The second component of that is to do medication management. We saw in the work that we are doing that sometimes people come to us with over 27 kinds of medications that they're on. And
Polypharmacy problem.
Polypharmacy, exactly. It's hugely problematic. The other component is, we call it mentation, and that has to do with how we build brain health, how we promote social integration, and just being part of a community and having a purpose in life. And then the last part is managing mobility, making sure that people can be mobile, make sure that people can, don't fall, have everything safe for them. And all of that is surrounded with social determinants of health that we need to develop.
And this grant was for $750,000, right? Am I right? No.
It's 750,000 times 5.
Oh, per
So,
year. So per year.
yeah.
So it's a big.
It's a big.
grant.
It's almost it's almost $4 million.
Almost $4 million over 5 years, and it is specifically targeted though at rural areas of the state. Correct,
That's
Joe?
That's what's exciting about it, yes. And it's really what we're really excited about is really having the University of Louisville be in Corbin, Kentucky, and eastern Kentucky, and throughout the whole state, and really taking our integrative model of healthcare with our interdisciplinary team into the different healthcare systems. So we're working with the University of Pikeville, we're working with Western Kentucky University,
Campbellsville.
Baptist Hospital, Corbin. So all of these healthcare systems that are so siloed, what we're doing is bringing age friendliness to them in an integrative fashion. So that's what's really exciting. So not only for us in the Kroeger Institute, but also for our students who are going to get a chance to interact with people across the state.
Talking with Joe D'Ambrosio and Anna Faul, both from the Kroeger Institute at the University of Louisville, talking about this big grant to help seniors out in rural areas of Kentucky with their health care. What are some of the specific issues that are facing older folks out in rural areas of the state that this grant and the work of the Kroeger Institute and the Kent School of Social Work, School of Medicine from UofL are going to try and address? Specifically, on the ground, what are you going to be doing?
We are going to promote wellness for an older adult. We're going to integrate their care. We're going to provide care coordination to the level that they have not experienced in rural Kentucky, because there's not enough professionals who know about aging care. There's not enough professionals who has that skill set. So we are going to be the hub here at UofL, and we're going to have our spokes out in the community, and we're going to do a lot of education and training that way. We're going to send the workforce out that knows what to do, and we're going to do a lot of that using Zoom technology, where we really zoom into these professional practices, the hospitals, places out in the rural areas, and teaching them how to do integrated healthcare.
Yeah, one of our big problems is that most primary care physicians don't really understand geriatric care. And when you're caring for someone that's older, it is a little different than caring for someone younger. So our training really infuses geriatric medicine into care.
Mm-hmm. And I saw as part of your grant application, or the synopsis of the grant, that you plan to train about 8,000 almost geriatrics, folks in geriatric medicine, correct? Over
Yes.
the next 5 years, is that right?
Correct. And not only the professionals, but also older adults will be trained. So, it's a workforce training, but it's also a community training. So we would also train people that's in the emergency medical field, the
EMS workers.
EMS workers. We will train caregivers. We will train everyone.
The area agencies on aging, also working with all 15 area agencies on aging, which is real important because they provide most of the care to those people that can't afford to pay for it.
Mm-hmm. Is it a case where people live out in rural parts of eastern Kentucky or someplace like that they just don't have the specialists that know about dementia and Alzheimer's and issues, other geriatric issues? Is that the problem, to try and get A, some expertise in that area, and B, those folks that are in those hollers to the right medical complex or the right doctor in Pikeville or Ashland or someplace like that?
Yep, Mark, you really don't have to go that far from Louisville to find that. There are doctors, we have primary care doctors, but they're not specifically trained in geriatric medicine. So the goal is to infuse that into our whole state.
And I think, to add to your point on specialty care, many times what you need is a specialty consult, but you don't need to always see a specialty physician. Sometimes all you need is someone who can coordinate the care between everyone, and they're one voice who can bring everything together, create less confusion for the older adult, less confusion for the family, and then have the specialist involved, let everyone function at the top of their license, basically.
Okay, we're talking with Anna Faul, Joe D'Ambrosio from the Kroeger Institute at the University of Louisville. It's the institute that kind of helps with, as Anna says, aging from birth to older folks, but mainly concentrates on the older folks in our population. Also, Hispanic populations that are growing in Kentucky and every other state. Is that part of the target as well for this grant?
Yes, very much so. So we work locally with organizations that work with Hispanic people, and they are a population that's really in need of help. From a medical standpoint especially.
And there's a lot of language barriers there, so we train our students to speak Spanish, at least the basic Spanish understanding, so that they can be a little bit more friendly and culturally sensitive to the needs of the Hispanic population.
And you're calling this what? What's the name of this this grant or this?
It is Flourish.
program?
We call it Flourish Care.
Flourish Care.
Yes.
How'd you come up with that name?
Well, you want to try?
Yeah, so we were thinking, what is it that we want people to do? We want everyone to flourish. We want them to live the best that they can, even if they have disease. Disease should not prevent you from flourishing. So our thought process with older adults is that as you get older, you're going to get sick and then you're going to die. And our philosophy is, as you get older, disease may occur. Let's address it and have you flourish to the highest level that we can have you. So even the person with Alzheimer's disease, and they're deteriorating, it doesn't matter. They could still flourish until that last moment.
Joe, Anna, appreciate you being on the show. Thanks for listening to UofL Today with Mark Hebert. And as always, go Cards.